Thank you all for coming again on a Friday night. And the reason I'm giving up my time here on a Friday night is because this test has been under the radar for far too long, and now it's really ready for prime time. And because I have seen the effects of using this test in my practice, and it has really been unbelievable to the point where I'm now using it on 80% of my patients, and it's not because I'm recommending it for 80% of my patients. I'm recommending it at this point to 100% of my patients, and 80% of them are taking me up on that invitation to have this test done. And it's been so successful now, I am getting an incredible amount of referrals about just saying I'm here for my food sensitivity testing because I just don't know what to eat. And my friend or my relative had this test done and has just been blown away by the results. So it is actually generating an incredible amount of new business and new referrals for me. And so that's why I'm here. Because we all know from studying functional medicine that there is something about this entity called food sensitivity that is somehow clinically relevant, but the testing, at least for me in my experience, has been challenging to interpret. There are so many different tests out there. How do you know what to use? And most of the time they come back with so many foods that people are overwhelmed. And then instead of engaging them in a conversation or a therapeutic encounter and giving them information that can be helpful, they're in this state of overwhelm, they're in this state of shock and awe, and you really can't get past that. So this, because of its accuracy, we're going to go through that, this test actually tells patients what they really need to avoid. The other thing about this, and I'm mentioning this up front, is for those of you that do diagnostic testing for increased intestinal permeability or leaky gut, this test in and of itself is a diagnostic test for leaky gut and increased intestinal permeability, so you no longer have to have a separate test for that. So food sensitivities are incredibly common, they're incredibly prevalent. These are the statistics, 100 million people worldwide. It's increasing, we all know this. The issues of gut health are just increasing, and food sensitivities are one of the main causes of that. And we all know that the manifestation of food sensitivity goes across a wide clinical spectrum. Simply skin stuff to real chronic illness. It's mostly confined to these 8 food groups. And one food or all of the foods in that group can be problematic. And there's also an entity about delayed food sensitivity, depending on which IgG molecule is triggered. And this is one of the few tests that tests IgG1 through IgG4, and we'll go through why that's so important clinically later on. The other thing this test does that other tests don't do is test for activated complement. So we as functional medicine practitioners are all over this concept of inflammation. But the link between an IgG sensitivity and inflammation, we may not be clear about that, and the link is not as direct as activated complement. C3 complement is the direct mediator for the inflammatory response, the pro-inflammatory cytokines, the pro-inflammatory leukotrienes. And so finding foods that activate complement, that's always been the holy grail for food sensitivity testing, and that's what this test does. And the importance of that is that activated complement can cause destruction locally and systemically. When we talk about IgG responses, it's usually from an immune complex, and it's usually distant from the site of the intestine. So that immunoglobulin complex travels, and you get issues in places other than the gut, distant sites. This complement can be distant and can also actually cause problems in the gut itself. So when do I use it? If my patient doesn't feel well. Now you'll see why I get to 100% of my patients, right? I don't feel well. I've got a thyroid problem, primarily Hashimoto's, any kind of joint issues, any arthritis, brain fog, autoimmune disease, any kind of fatigue, any digestive or gut issues, infertility or first trimester loss. So I'm going to show you some very interesting literature, because I'm in women's health, about infertility, first trimester loss, fibroids, endometriosis, or breast cancer, and then any other cancer. So this is how I get to 100%. And if there's something here that you see that's not on the list, we can talk about it later, and I guarantee you I can give you a biological reason why you should do food testing for that symptom complex. So why do I use it? We went through when I use it, but why do I use it? Because the immune complex issues and the inflammation that's associated with foods are an underlying condition for, or underlying problem for every condition I see. And if someone comes in for optimal wellness, they also buy themselves one of these tests, because we want to prevent any sort of problems from developing in the future. So why do we focus on the gut and food reactions? This is basic functional medicine, right? Where do we produce 3/4 of our neurotransmitters, 2/3 of our immune tissue, 10 times more cells than the rest of the body combined, genome 100 times larger than our own genome, and metabolic activity greater than the liver. Now, for me, what I've learned over, let's say, the last 5 to 7 years in my practice of functional medicine is what we call the gut-brain connection. And it's amazing how patients get better with depression or other kind of dysphorias or mood issues once you heal the gut. And this is a primary way of doing that. So what's the answer to that? Clearly the gut. And what's the first gut issue to understand? The first gut issue to understand is increased intestinal permeability. So you all know this. This is teaching or speaking to the choir about why it's important. Because the gut mucosa is exposed to the external environment. It appears to be inside, but it's really exposed to everything externally. Bacteria, dietary antigens, right? So foods, viruses, but it's far greater quantities, and this happens daily, far greater quantities than the systemic immune system. That, to me, is a piece of information that's very powerful. So if we're having something that is problematic for the gut immune system, that's a big deal. And this is then what the immune system sees in a lifetime. More on a daily basis than what the immune system sees in a lifetime. That's very powerful. So I just want to go through this diagram a little bit closely, because this explains why gut issues are so important. So we start here on the top left with people eat and foods enter the gut. And then what happens if our digestive system is working properly is we have enzymes, and those enzymes take those long polypeptides and cleave them into smaller fragments. We also have enzymes, and then those molecules get transported and absorbed in a selective basis, so that theoretically only what we want to get absorbed into our bloodstream actually comes into our bloodstream. Sometimes, however, as you know, we have a release of some of the proteins that keep these intestinal cells together. And that leads to bigger molecules getting in than should get in. Now, what you need to know is that sometimes the breakdown products of foods actually create inflammation, and that inflammation then creates more breakdown. It becomes a feed-forward cycle. So we see a breakdown here, so things get in, and the molecules that usually keep these tight junctions tight, they end up going into the bloodstream. The immune system makes antibodies to them, and then you attack the actual compounds that are supposed to keep the intestinal cells together. When you attack the compounds that keep the cells together, the cells just get further and further separated. And so then we see these larger peptides coming through. And then they get presented to antigen-presenting cells. And then you get this whole inflammatory response. And you release TNF-alpha, interferon gamma, and those local issues create more inflammation. Then you have T cells, which get turned on. So you have an increase of cell-mediated immunity, as well as stimulating beta cell formation and formation of more antibodies. So it's a sort of cell-mediated as well as a humoral antibody system. Both are activated. And that produces more cytokines, killer T cells, antibodies, autoimmune disease, and you actually attack the small intestinal cells themselves. So it's not just a distant immune complex deposition issue, it's actually destroying both the cells themselves as well as the proteins that keep the cells attached to each other. Then you lead to deposition of immune complexes in different tissues. Those are those antigen-antibody immune complexes, and that creates problems in and of itself. Activated complement in distant sites. So now you're getting inflammation in distant organs like joints, inflammation, and symptoms. And that's the circle of disorders that come from leaky gut. And so this is a slide you've all seen about a healthy gut that only selectively brings in molecules that it wants. The cells are tight, healthy cell junctions. And then what happens when we have damage? Now notice we're starting here with damaged cells, but the reason these cells became damaged is because there was a local inflammatory response with chemicals, with complement, as well as direct antibody damage to both the cells and the molecules causing those tight junctions. And so here you see now what comes in through the intestine. Remember, more antigens are presented to this immune system than the systemic immune system in a lifetime. And this is what happens on a daily basis. So then you have all these molecules coming into the bloodstream that are foreign, that shouldn't be there, and that upregulates the immune system. So what else about increased intestinal permeability is that an intact intestinal barrier is critical to normal physiological function and prevention of disease. So if we're talking about optimal wellness or any type of chronic illness, you have to have normal intestinal permeability. Now, remember I said that this test is a de facto test for increased intestinal permeability. So not only do you find out the foods that people shouldn't be eating, but you see the degree of increased intestinal permeability or altered intestinal permeability. The way that works is by looking at the antibody response to Candida. So if you see an antibody response to Candida, it doesn't mean they're allergic to Candida or they have to avoid foods containing Candida and they have to go on an anti-Candida diet, though you may choose to do that, and it makes sense because they have antibodies to it. But the most important piece of information to get when you see Candida on this test is that they have increased intestinal permeability, that they have leaky gut. And we know that because almost everybody has small amounts of Candida in their gut, but it's not supposed to cross. So if the Candida gets into the bloodstream and the body is then able to create an immune response to it, by definition they have leaky gut, that Candida has crossed that barrier. So that's why this is such a great test to diagnose leaky gut. And mild, moderate, or severe, it depends on the amount of antibody response you see to Candida. So what are the causes of increased intestinal permeability? How does it relate to illness? This is straight from AFMCP and the GI module. All sorts of causes lead to increased intestinal permeability, and then food allergy and food sensitivity and disease. So you know all about this. The piece that is new here is this. This isn't taught yet at IFM. You're learning it here, that food allergy and food sensitivity actually causes increased intestinal permeability. I showed you that on that diagram before because the inflammation actually attacks and destroys the intestinal barrier. So it is bi-directional. So I've just explained what's wrong with having increased intestinal permeability. It leads to disease and all sorts of diseases. It really can be anything. The literature is a little bit behind when they list the illnesses and the problems with increased intestinal permeability. Really anything can be caused by increased intestinal permeability. These are just some of the references. But I want to show you something that is important if you're taking care of women of reproductive age and why you need to look at something like this. So let's look at first trimester loss. And it's nice to have a perinatologist here in the room who knows this literature and these concepts so well about inflammation causing first trimester loss, right? So inflammation is bad everywhere. It's also bad in the reproductive spectrum. And so whether we're looking at prenatal or pre-pregnancy, preconception health, or we're looking at obstetrical care and obstetrical health and preventing things like preterm labor and preeclampsia. So when I do preconception health visits with my patients, I always do this test because I want to, number one, reduce the inflammation in their body from the foods they're sensitive to, but if they've got increased intestinal permeability, I need to treat it because I don't want them to miscarry. And I don't want them to miscarry because gut health and intestinal permeability actually affect first trimester abortion rates. So this is a diagram that's challenging to understand, but what the main point here is to look at some of the differences in pregnancy loss, and these are significant, the differences in pregnancy loss, and why do we look at indomethacin, for example? We look at indomethacin because that's an experimental design or an experimental model of increased intestinal permeability. So that's one of the things that these nonsteroidals do when you take them, and so it experimentally induces increased intestinal permeability and causes an increase in first trimester loss. I don't know about you, but my patients are interested in cancer prevention. And some of them come in with a cancer diagnosis and certainly don't want a recurrence or don't want issues with cancer treatment side effects. So here we see stronger intestinal permeability, stronger intestinal barrier prevents cancer in the rest of the body. Who would have thought? Leaky gut may be the root of some cancers forming in the rest of the body. And here we see specifically breast and colon, New York Academy of Sciences, talking about increased gut permeability there on the bottom right as a causation of breast and colon cancer. And it's really about inflammation and distant sites of inflammation as well. So again, a test like this, because it tells you the foods to avoid and it tells you if there is leaky gut, is helpful for cancer prevention. What about issues after cancer treatment? Significance of altered GI permeability in cancer patients. So intestinal permeability testing, which is the FIT test, may represent a tool for non-invasive objective assessment of intestinal toxicity of anti-cancer therapy. Wow. I mean, this really is a wow. So increased intestinal permeability is obviously quite important. So did you know with food intolerances, so 50 to 100% of food intolerant patients have increased intestinal permeability. So this is this bidirectional issue that we talked about. Increased intestinal permeability causes more food intolerances, and food intolerances cause increased intestinal permeability. So understanding all of this is critical for your practice. And if I didn't feel so strongly about this, I wouldn't be here. You know, I'm involved in the hormone module, and I actually teach the GI module when or the GI part of AFMCP when I go international. So those of you that heard me in London in October, I did gut health, right? So this is a very, very important topic that's really near and dear to my heart. So just understand that this is not food allergy, which is an IgE response. It's a hypersensitivity reaction. You see the welts on skin testing. This is 12% of the population has IgE, but 90% of food allergies are not allergies. They're what we're talking about here, which are sensitivities. So now we're talking about a third of our patients. So a third of the patients that have a reaction to some food really ends up being all of the patients that come into your practice because of the issues we talked about. They've got some chronic illness, or they just want optimal wellness. So allergy is IgE, sensitivity is IgG or IgA. Intolerance itself is nothing to do with immunology, but just usually an enzyme issue like lactose intolerance. Now, let's talk about IgG. IgG is the main immunoglobulin. 21 to 23 days, that's why when we do the elimination diet, it's a 3-week diet. Now, there's 4 types of IgG, and we're the only food testing company that tests for all 4 types of IgG, and I'm going to show you in a couple of slides why that's important. So IgG, again, everything. That's really just the way to think about it. In fact, if you're taking the certification exam and haven't done so yet, pretty much anything can be caused by food sensitivities. So you know how to tell the difference between an IgE response and an IgG response. One of the big differences is this is a mast cell issue, and this has that immune complex piece that we talked about, or complement. So this is just to show you that symptoms of IBS get better when you do a true diet, which is eliminating the foods that you have an IgG reaction to, or a sham diet where you don't. So if you've got an IgG reaction and you eliminate your diet, you eliminate those foods, your symptom severity decreases. 10% greater reduction, and 26% if they're fully compliant. Why is there a distinction? Because you do this in real life, in the real world. Well, I can do mostly gluten-free, but not all. Or mostly dairy-free, or I only have eggs 2 days a week instead of 5. So that's why there's a difference. So yes, there is a benefit to doing it most of the time, but it's really not anywhere close to the benefit of doing it all of the time. So here we see level of adherence, and a low level of adherence versus a median level versus high level. And you see the vast improvement in terms of reduction of symptoms if they truly adhere to avoiding their foods. And so immunoglobulin G4. So remember I said there's 4 different types. No one else tests for G4. And G4 here in the literature shows that 78.5% of patients had resolution of symptoms, and that the testing improved after just 2 months. So inflammation, intima media thickness in obese juveniles. So I was talking to someone today who is just starting a position in an obesity clinic. And I said, oh, you know, you have to do this kind of testing because one of the things is that patients come to me for weight loss. And when they avoid the foods they're sensitive to, the weight goes off. And here we see that happens as well. And it happens through the mechanism of reducing inflammation. Also helps with migraines. Crohn's, and I'll just go through this because I know it's Friday night, but again, Crohn's patients as well are improved when they avoid these foods. It's really everything. All sorts of symptoms that maybe you don't even know what they come from. Right? Patients come to me with a long list of symptoms, and what I've learned to do in practice, I say, okay, it's our first appointment, just pick 3. And let's just work on those 3 and maybe 4. What ends up happening when you work on the 3 is that like 6 other things go away too, but it can be overwhelming, and sometimes it's so overwhelming I don't know what to do, and I just say, let's just start with avoiding these foods, come back in a month, and let's just see what's left. That's a line that works really well in my practice. When I don't know what to do, I don't know where to start, I just start with the gut, right? You've heard that, treat the gut first. This is the easiest way to treat the gut, right? A good probiotic, some fish oil, and avoid the foods that you are sensitive to, and you are the best functional medicine practitioner out there. Everybody's starting to get better, they feel better, they're losing weight, and they're sending their patients to you. I can say that now because this is not an IFM event, so we don't have to worry about the matrix. You don't even have to worry about the matrix. All you have to do is do this test. So you want to eliminate foods for at least 4 weeks, and what's nice about this test is it's not forever. It's really not 4 weeks, it's closer to 12, but people sometimes get a little bit worse. That has to do with some immune complex issues. So prep people for that, but I'll tell you, I really haven't seen that. Usually what people will do is they'll have almost like a withdrawal to sugar and stuff, like we all know what patients have when they do that. So from the literature, which is what this was, a little bit of a literature review, IgG testing, clinical usefulness, it improves adherence to whatever your protocol, and then you see that it's a sign of underlying inflammation. Use a laboratory that's trusted like KBMO. So why is KBMO? Now I must have had a slight dyslexic attack while I wrote this slide because it's KBMO. But why do I like this lab? It's been around for a while, it's CLIA certified, it's got all the bells and whistles for a good laboratory. Aside from the fact that the CEO of the company is incredibly trustworthy and lets me ask him as many questions as I can, and then he's put me in touch with his scientific director, his chief science officer, who is incredibly bright. He started or came up with the first at-home test for HIV, and really, really, really bright man, and I just can call him anytime with just questions like, I hate to admit to this, but let's say I wake up in the middle of the night and I've got this thought about how do these immune complexes actually work in this particular tissue. I can like remember that question in the morning and just call him and just ask him anything. And if he doesn't know it, we'll figure it out. We'll find the literature. So they will, I'm sure I'm speaking for James White by saying if you have any kinds of questions like that, just call him and he will be happy to punt that question to his chief science officer. This is just a diagram showing how what they are able to find is activated complement, not just IgG. So remember I said it's IgG 1 through 4, but also anti-complement antibodies. So when there's activated complement, that creates, as I said, the pro-inflammatory cytokines, the pro-inflammatory leukotrienes, which have a local as well as a systemic effect, and it can find that as well. So it tests for 132 foods, pretty much everything everybody eats. It's a finger stick. What does that mean? It means, number one, patients can do it in the office. It's easy. Or they can take it home. Or if you, like I do a lot of phone consults, you can mail it to patients, within your state, wherever you're licensed, to do the test. And the patient report is really easy to understand. And if you want, you can make use of a checklist and intake form about what sort of are the symptoms that cause food sensitivity. I bypass that. I don't need to do it because, as I said, I think everybody should have this test. So these are the foods, and it's a finger stick. And all you do is fill these little spots, these little circles on a piece of paper. It's very easy. At the booth, they show you everything on how to do that. This is the symptom checklist, as I said, that I never look at. This is what the patient report looks like. And what I like about it is, number one, if one of these things lights up, you can immediately say, well, these are the grains in the category. These are the grains that you can eat. So if there's a problem with a particular fish, again, these are the fish that you can eat, so that they see that right away. The other thing that's new, I don't have a slide on this yet, is that you actually get a rotation diet of the foods. So it's a menu plan for 7 days of what are the foods that people can eat. So they're not overwhelmed. They don't have to spend money to see a nutritionist or a dietitian, and they immediately know what they can eat. So it does all the menu planning for them. So this is what, as I said, what the report looks like. This is just a study that they did for 30 patients with the testing before and after the elimination diet, showing that it actually does go away. So if patients avoid these foods and you repeat the test, the sensitivities do go away. So I'm just going to show you one case. Okay, so yes, I'm embarrassed about my handwriting. And so 48-year-old woman, we won't go through all of this, referred. Now, I can't say this is the most detailed of histories. Weird GI symptoms. But eventually you do this long enough, you sort of know what you're doing. And though I listen to whatever these weird symptoms are, it's hard to just write them all down. So I'm just like you, I am in the trenches. So she's got some weird symptoms, at least she knows what they are. And then, so here's my detailed history. Her gut was well until 3 years ago. Then would wake up with stomach soreness, waxes and wanes. It's not worse. Last full blood work was 2 months ago for vertigo. And not much stress. She's good emotionally. Spiritually, she's great. She's an atheist. And yeah. So anyway, this is my really complex tertiary functional medicine note here. Gut issues, is it IBS? And so then what did I do? I gave her some stomach acid, the FIT test. I said a Nutrival, a metametric stool, and then I wanted to do the genetics for HLA, DQ2 and 8 because her son had celiac, full blood work, B12, adrenals. Okay, my diagnosis for the blood work, because the nurses always need to know what the diagnosis is, for my tests was IBS. So then the nurses are very good, explain the test, did the FIT today. Why do I circle this? Because this actually got done, as opposed to here where she goes, of course they don't always listen to me. I don't know if your patients always listen to you. Mine do not always listen to me, and now it's documented that they don't always listen to me. She didn't do the Metametrics or the Nutrival, but she did do the FIT, probably because it was in the office, right? And so then she comes in, and here you see my detailed note that we discussed the FIT test. And here we see the results. So she was 4+ gluten sensitive. So this is the classic gluten, dairy, egg, right? That's the trio. And so here we discussed it. She was going to, first I thought she did the other tests, so she was going to await the other tests, avoid the foods, but then she goes, yeah, well, maybe I'll do the other tests. So anyway, she was going to avoid those foods. And how do you like that? I feel great. I feel really good. Huge difference. She wants to stay, or skip rather, all of her supplements, which she never really started. And then she's just going to continue this until January. So this is someone who really, this was only foods. It had not, she didn't want to do anything that I wanted her to do. She was very clear, and it worked. So I'm just going to show you what she had to say. Okay, everybody, this is Dr. Joel Evans talking, and it is November 3rd today, and I'm here with Kimberly, and Kimberly came to see me, and thanks to this KBMO test and some supplements, wants to report how she's doing. So, Kim, tell us, what was bothering you before, and how do you feel now?
Well, I feel fantastic now, and I have to say I was very skeptical because on my own I was trying all kinds of dietary changes because I was just having problems with feeling unwell in my stomach over the course of a day, and it was interfering with my workout schedule and the rest of my life. So I came in and we ran a couple tests and found out which foods were problematic for me. And I also started a course of different supplements, and I feel like a new person. Like all of the stomach issues that I had before are gone. They're just not an issue any longer. And I feel I can count on waking up and feeling great every day. So it's a huge change.
Oh, so nice to hear. And so that really says it all. And this test really works. It's easy. It's a finger stick. It's sensitive. It's accurate. It's got all the bells and whistles as far as laboratory that you want, and great outcomes. And a bunch of my faculty friends are starting to use this in their practice. This is sort of really below the radar, and now coming into, we're pushing it into widespread use. So thank you. And if you